क्लॉक एंड या वी वर टेलिंग यू कि हमारी बात जो है 10:40 के आसपास होगी डॉक्टर योगेश्वरी सत्यनारायणन से, स्पेशलिस्ट कार्डियोलॉजिस्ट, मेडकेयर रॉयल स्पेशलिटी अलगिसेस. गुड मॉर्निंग डॉक्टर, प्लेजर टू हैव यू ऑन आवर शो.
Good morning.
Yeah, very good morning. Morning, Nikita and Vivek. Thanks for having me on the show today. And it's really great to be here. And I feel very honored to be talking about something that is going to really matter.
Absolutely. We were discussing yesterday about the celebrity model actress Shefali Jariwala, and it is very unlikely for women to have cardiac arrest. And if you could tell us more about cardiac arrest, especially for females below 45?
Yeah. Actually, if you see, both in men as well as in women, if you see, heart disease is a leading killer, actually. So, in fact, it doesn't see any gender disparity in that, at least. But, having said that, in women, they have this, apart from the routine risk factors like having high blood pressure, sugar, cholesterol, and all that, they also have certain gender-specific risk factors, if you would see. Like, for example, those who these days you see a lot of pregnant women, at a little older age, and they tend to have high blood pressure, sugars, and cholesterol during their pregnancy. And some of them land up having preterm deliveries. And so all of these people, especially, they tend to be at heightened risk for getting all of these risk factors at a much earlier age. And we need to really follow them up. What happens is many of them kind of get overwhelmed and with the incoming of their newborn, and they don't really bother about their health. So if you follow them up, most of them end up becoming hypertensives and diabetics, and they will definitely need medications. So that is one thing. And when you look at women in specific, actually, they are physically, they're psychologically, they're biologically very much different from what men are. And it's very disheartening to see that women, for example, compared to men with similar risk factors, but their outcomes tend to be much, much poorer. Now, the reason being that, the heart diseases generally tend to, manifest in a very different way in women as compared to men, and it gets really detected much later compared to men. Because if you see women, their tendency, when they have any symptoms, the first thing that they will probably do is try some home remedies, take some ginger juice, this. Then probably they'll want to wait until their husband comes to pick up and take them to the hospital. They'll want to see that their kids are kind of safe when they go to the hospital for their checkup. So by the time they actually reach the hospital with their symptoms, they present very late, and that leads to very bad outcomes, even if they have, features similar to what men have. So that's something women should really be aware of, and women are the ones who are in great denial that they could probably having a heart disease at such a young age. So yes, yeah.
Dr. Yogeeswari, in terms of the rising cases that have been reported about cardiac arrests among younger individuals, could you share some advice to the young individuals out there listening to us, some things that they need to keep in mind as an advice from your end?
Yeah, I think, if you see in the UAE, the statistics are quite disturbing, and it's giving a very alarming trend. Now, one of the recent audits, if you see from, the Cleveland Clinic, Abu Dhabi, and in fact, it has been confirmed by doctors across multiple hospitals that half of the heart attacks are less than 50 years of age, and in that, 10% of them are less than 40. And, if you see, most of the heart diseases are lifestyle diseases. 80% of them are preventable. As much as I take pride in telling that, it also is very disturbing to see that, that is the number one killer, despite the fact that 80% of the heart diseases can be prevented. So lifestyle changes are one of the most important things that we see here, which can contribute to this. Many younger generation are into this kind of grind culture. They kind of overstrain themselves. And then they do a lot of multitasking, multiple jobs they take, they go through enormous stress, and they have a very bad sleep hygiene. Now, all of these can put them at heightened risk for getting, heart disease at a much younger age. Now, apart from this, when you look at the younger population, you have to, if any of their family members tend to have a heart disease or stroke at a much younger age, they have a heart disease or stroke at a much younger age, they have to definitely get themselves screened. they should not really wait for the symptoms. They definitely have to have themselves screened. For example, if there's a family issue of diabetes or high blood pressure, they have to screen to see if they are having it, because by nature, because of the family issue, they'll be at heightened risk to develop at a much earlier age compared to their peer group, wherein they don't have any of these risk factors. Now, apart from that, if they have any of the family history, yes, before they enroll themselves in high intensity training programs in gyms, they have to make sure that they get their cardiac screening done before they do that. Otherwise, that is why you see many people go to the gym with high intensity exercises and they suddenly drop down dead. And they may all think, or they may all look aesthetically fit, but internally, if you say, they're metabolically completely broken. So, and another rising concern, couple of rising concerns in the young people is unregulated use of all these stimulants and supplements, to shred their fat much faster. That's something which can definitely lead to heightened risk. And not to say, we have an alarming rise in the vaping trend among high school students. If you see, almost 1 in 4 high school students tend to vape, and that's a very alarming statistic. And that is again one thing that can, of course, UAE government is doing lots to put strict rules and consider it as a serious behavior. But I think all of these contribute to the heightened risk of heart diseases in younger individuals these days globally. Yeah.
Dr. Yogeeswari, you did mention a regular screening can definitely prevent any mishaps. But also, are there any symptoms? For example, there is some shoulder pain or some arm pain or palpitations happen suddenly when you're sitting. Are there any symptoms that indicate that your heart is not in a good condition?
Yeah, very much. I do tell my patients, in fact, a small tip is that if you remain physically active, you can figure out these symptoms much, much earlier. Now, for example, if somebody is doing a regular physical activity like walking for 5 kilometers and probably in 45 minutes, but if for some reason the same distance, if they cover in the same time, but they're feeling tired or fatigued, in fact, that is one of the early symptoms of heart diseases. So being physically active, one, will help postpone getting the disease if you're prone to. Number two, even if you have the disease, it will help identify the disease much earlier. So having said that, if you happen to experience any exertion or effort-related symptoms, for example, whether it be chest pain or shortness of breath or palpitation, feeling one's own, heartbeat, or you have any dizziness or syncope, and any of these symptoms, especially if they club together and come, all the more reason. Most of these symptoms, if they happen to have an exertional worsening, that is heart and only heart, unless and until it's proved otherwise. So unless and until you move your body, you never get to know, that you're having any of these symptoms. If you're having a sedentary lifestyle, it's impossible for you to get to know if you're even harboring a serious heart disease. So I think one important clue is to stay physically active, and being physically active, and if you have any exertion or effort-related worsening of the symptoms that I mentioned, you definitely have to get your heart screened. Yeah.
Dr. Yogeeswari, is there an evidence that premature heart disease occurs in the UAE as compared to the Western and Eastern countries more?
Yeah, I think I did mention in the beginning of the talk that, Cleveland Clinic Abu Dhabi had conducted a audit among all of these patients who sustained heart attack, and it was found out that almost 50% of these patients were under 50 years of age. And in fact, in that 10% were under 40. And in fact, in my practice, I've seen even the youngest age that I've seen as so far is 28 years. So, and this is not just one hospital, and it's been confirmed by doctors across multiple hospitals. And in fact, we are seeing a shift in the trend of the cardiac arrest by almost a decade in UAE compared to the Western nations, and it's extremely scary. Yeah.
Dr. Yogeeswari, on a lighter note, does heartbreak have any significance in weakening heart condition?
Yeah, I mean, in fact, even when I was small, I used to think, what are they even showing in movies? Somebody, goes through heart failure and then they catch the chest and then they drop down. But in fact, it's actually true. There's an entity called as, Takotsubo cardiomyopathy. And, when people go through extreme or, heightened emotional stress, their heart pumping function suddenly drops down, and that can definitely cause heart failure. So it's not a myth, it is actually true. So it's important that we know to calm and compose ourselves and handle stressful situations in a much better way. Yeah.
And also the cooking oil that we use. Lot of cooking oils advocate that, this is good for your heart. How much should we rely on them?
I think it's not right to have all these supplements or stimulants directly purchased over the counter, because an unregulated use of all these can cause increase in the heart rate and BP. Especially, you have this pre-workout supplements, you have these fat burners. So all of these, unless and until it comes as a supervised prescription from your dietitian or your doctor, it's definitely not good for you to take it over the counter and use it yourself, thinking that, you're doing the right thing. No, definitely not.
Doctor, how significant would be the role of the genetics and the family history in terms of the early onset of cardiac diseases among the UAE population?
Yeah. So this is becoming very common. Whenever we encounter any younger people, with heart diseases, definitely if you see there must be some family member or an index member in the family who've had a heart disease or a cerebral condition like a stroke. Now, the fact that you have a family member with any of these puts you at heightened risk. Simple. And these people should start screening as early as from the second decade of life. So now you don't have any family member and you can still start screening yourself from 40 plus age, provided you don't have any other additional cardiac comorbids like diabetes, hypertension, all that. But yes, when you have a family history, definitely you should have your cardiovascular health screened or cardiovascular risk screened beginning as early as second decade of life. Yeah.
Any quick tips for everyone to keep a healthy heart?
As I told you, heart diseases are predominantly lifestyle-based diseases. So I think just looking fit doesn't mean that your heart is, and it's no more that, it affects only the elderly people. You don't need to have gray hairs to have clogged arteries. So I think move your body daily, have a good sleep hygiene, 6 to 8 hours of sleep, and then prevent smoking, and if you have any family history, please come for checkup and don't wait until symptoms happen, because by the time you recognize all of these, when the symptoms happen, it might be too late. And many of the times, in heart diseases, the first symptom could be your last. So I think it's important you understand all these risk factors and get yourself screened much, much earlier.
And don't watch horror movies also.
And too emotional movies.
So it's okay for you to watch horror movies as long as you know how to compose yourself. When you're watching, don't get too much scared. Yeah.
And don't watch a beautiful girl where your heart skips a beat. One beat is okay.
Please don't tell that. None of the young people are going to come to me to get themselves screened.
But
Doctor, I'm going to tell them to stay away from love.
It's very important when you pointed out about this horror films and also about the emotional films as well. Those that, put your heart at the risk of being too emotional. But doctor, before we let you go, my last question would be about the screening protocols. Could you name some of the screenings that people listening to us can actually come over and do in terms of, any preventive measures and screenings over the years?
I think it's important they first consult a doctor before they can, just enroll in any screening packages, because it's important that we analyze the risk and choose the tests accordingly. Like, for example, somebody who has a family history of diabetes, high blood pressure, you need to get yourself some basic checks done, with respect to your sugars, your cholesterol, and probably get your blood pressures frequently checked more than often. But somebody who has had a strong family history of premature heart disease or sudden death, definitely they need much more evaluation in the form of a, ultrasound for the heart, what we call as echocardiography, or probably a treadmill or a stress test wherein we can bring out things even if they are asymptomatic. So I think it's important for them to see the physician first before they can, get all these screening tests done. Yeah.
Superb, Dr. Yogeeswari. It was a pleasure. Thank you so much for bringing this awareness among us, and thank you so much for your time this morning.
Thanks a lot for having me here for such a useful and a wonderful conversation.
Thank you, doctor.
Thank you. Yeah.
ये सब यूजफुल बातें करते हैं तो बुरा एक रिमाइंडर होता है हम सबके लिए कि एक बहुत इंपॉर्टेंट पॉइंट उन्होंने बोला कि यार कसरत